Hello, my name is Maury Wiegand, and I've been a fitness and wellness educator in Bozeman for the past 25 years. I'm also a graduate student in public health at the University of Montana, and I'm currently studying ethics in public health. In the following discussion, I hope to review the ethical considerations relevant to a policy which would mandate the wearing of masks in public places. This will include why is ethical analysis important, moral considerations and how they pertain to the case, the costs and the benefits of the policy, the use of an intervention ladder in mandatory policies, and questions of legitimacy in the policy. Why is ethical analysis important in this decision? If we accept the idea that any policy adopted will have significant societal costs that cannot be fully ignored or justified, we often look to ethical analysis to help identify the trade-offs inherent to our decision. Ethical analysis can be helpful in clarifying the source and the nature of the disagreement between stakeholders, allowing decision makers to publicly explain or justify their decisions, and possibly revealing alternative options that might not originally seem apparent. Public health ethics rests upon a set of 9 general moral considerations that we will review as they pertain to this case. The first 3 considerations, producing benefit, avoiding, preventing, and removing harms, and producing the maximal balance of benefit over harms and other costs, which is often called utility, lean toward supporting the mandate of mask policy. There are several well-known principles in ethics that uphold these considerations. The harms principle, cited often in public health ethics, this principle holds that the only justification for interfering with the liberty of another individual against their will is in preventing harm to others. This principle is often viewed as the most compelling justification for public health policies that interfere with an individual liberty. Citing a precedent case in Gallatin County that portrays the harms principle is the Health Board's inclusion of electronic nicotine devices into the Clean Indoor Air Act policy in 2018, which clearly is upheld by the harms principle. Another ethical theory currently being utilized in pandemic response is the principle of utilitarianism, which states that the moral decisions and actions should be made on the basis of their consequences. Often articulated as an ethical statement, decisions should be made based upon obtaining the greatest good for the greatest number. Another moral value to consider is a concern as to whether the benefits and burdens of a policy are distributed fairly across social and economic groups. There is also a question of disproportionately benefits across age group categories. When a policy burdens some groups more than others in an unfair way, it must be justifiable in light of the overall benefits achieved by the policy. One of the basic moral considerations in public health ethics is respecting autonomous choices and actions, including liberty of action, moral consideration number 5. In assessing whether a mandatory mask policy justifies an infringement on liberty, it should be argued that the infringement must be genuinely necessary to achieve the public health benefit and that this benefit must be proportionate to the infringement. An important tool used in public health ethics is called an intervention ladder. It can help us think through policies and how they can affect people's choices, especially pertaining to liberties. As the interventions proceed up the ladder, they become more intrusive and therefore require stronger justification. As we review the ladder, consider where Gallatin County is currently at on the ladder. Step 5 through Step 8 are particularly relevant. What are the incentives and disincentives in wearing face masks, and can they be further promoted? Is it possible to restrict choices without eliminating choices? Moral considerations number 7, keeping promises and commitments. Number 8, disclosing information. This includes speaking honestly and truthfully, often grouped under transparency. And number 9, building and maintaining trust in the community. These considerations revolve around the moral value of legitimacy, which for this context refers to the board as having appropriate authority to make governing decisions, issue guidelines, make recommendations, and enforce rules, while maintaining trust and transparency within the community. Keeping the three moral considerations in mind, we can shape our answers in this process by examining the following questions. Have the mechanism for public engagement and input been constructed? Fostering this critical deliberation, public input will help in establishing transparency, trust, and finally, public acceptance. Has the input of a diverse set of experts been sought? Decisions should be based on the latest available evidence in the ever-changing landscape of COVID-19 science. Has clear and honest communication with the public been demonstrated? This should include discussions about the costs and the benefits of the policy and justifications for the adoption of the policy. And finally, will the board reassess this policy as the situation changes? In conclusion, this kind of clear articulation and ethical justification can be useful in communicating and engaging the community and diminishing public dissonance. Supporting your decisions with ethical justifications will help increase the trust you build in the community and support Gallatin County public health decisions both now and in the future.